Hi everyone, Kristy here from Shakira Plastic Surgery and Skin Clinic. I wanted to add a video for the Skin Games showing one of the devices that I used on my model. I used something called the M22, which is actually a whole platform, but it has an IPL on it, and so I used the IPL from the M22 to do a photofacial on my client. So for anybody who doesn't know what a photofacial is, it uses intense pulse light, or sometimes called broadband light, and that is a little different than a traditional laser because it doesn't have one specific wavelength. It uses a broad band of wavelengths, and we use different cutoff filters to target different lesions in different areas of the skin. So the platform has an IPL. Our platform also has something called Reserve FX onto it. It's something that we added to our platform. The Reserve FX is a non-ablative fractional laser. You can also get it with a YAG laser for treating veins. We didn't opt for that in our office just because we have a couple other lasers with that modality, so we didn't need to add that, but we love to have our Reserve FX, and if we do it with photofacial, we call that Fractional, which is excellent for treating stretch marks and scars and things like that, or even just for photo rejuvenation. So I was a little disappointed I could not get this glare to go away so I could show everybody what the screen looks like, because that's really exciting, so I can take pictures and add it later. But I wanted to show what makes this particular device different than some of the others. And we actually have 3 different IPLs in our practice. One of the things that is really important if you're doing IPL is to be able to have different cutoff filters. And some devices may have a couple, some may only have one, I don't know. But this particular one, I have a 515, a 560, a 590, a 615, a 640, a 695, a 755. There's also a special vascular filter and a blue light filter that was most recently added on. And the vascular filter I'm like in love with because it's a dual wavelength and it has a KTP in it. So for my laser friends, you can appreciate that when you're treating telangiectasias and broken blood vessels in the face, having a KTP laser is really effective. So with some of my other devices, I would go and do a photofacial and go back with a KTP laser and trace over all these little veins. So the upgrade that just came out with this device allows us to have a dual wavelength at the same time, and one of those wavelengths is a KTP filter, and is awesome when you're treating rosacea or broken blood vessels. And then the blue light, of course, for treating acne lesions, and it will kill bacteria in the skin, and that's also a dual wavelength, so we can treat deeper in the sebaceous gland and more superficial. And in our office, we also do something called photodynamic therapy, where you use Levulon, aminolevulonic acid, and you activate it with blue light, or you could do an IPL with it too. Sometimes I choose to add Levulon if I want to enhance my photofacial treatment. I describe that as photofacial on steroids. It just makes it more aggressive if I have somebody that's got lesions that just are being a little bit stubborn and not quite responding. Typically people with like skin types 1 and 2 that have that lighter, almost pink pigmentation, that sometimes requires me to add Levulon if I really want to take it to the next level. The other thing that's exciting about this, we have different spot sizes. So here's the standard one, it's large. Here's a small one. And then there's a mini, it's a little circle that I have on here right now. You can see that's small. I typically use this for treating veins. So you can see I could just take it right in there. Or if I just want to treat an individual spot, these things are so great. You just pull this thing up, pop them in and out. If I want to change my filter, it's just a little disc. So again, for some of my laser friends, it sometimes can be a pain in the butt if you have to take your whole handpiece off, put another one on. It's just really convenient for me to be able to just switch out the filter, switch out my spot size, and I can use multiple filters in one treatment, which lets my treatment be more effective, and I can get through a lot faster if I can quickly slip those discs in and out. If I want to do a fractional treatment with it, this is on the same device, so it looks like this. Circle that size. It's actually cold on the tip. This is the distance gauge. and I can actually do a fractional treatment in one pass versus one of our other devices where I have to roll it over 8 times. And let me tell you, by the time you get to that 8th pass, your clients want to kill you because it hurts. So I was really excited to be able to have something that I could do one pass. If I'm treating stretch marks, I'll do 2 passes, one with a deeper setting but less density, and another one with more density but not quite as deep. So that's really nice. Or I might just add it to a photofacial and just get full rejuvenation with that. So what I was hoping to show you, but unfortunately won't show on the screen because of the glare, is how this is really user-friendly. So I worked with an IPL device really early on in my career called the Epilite that was made by ESC Sharplin. And then they became, well, ESC became ESC Sharplin, and then they eventually became Luminous. And the original device I worked with, which was a total workhorse, it was awesome, but you had to know what was the appropriate setting. There wasn't like all these cheat sheets and everything. They've made these devices so user-friendly now. If you're coming into the industry and you're starting to work with IPL, you can just go in there, you hit the IPL, you can choose skin treatment, you can choose pigmented lesions, vascular lesions. It prompts you to put in the skin type, if they're deep vessels, medium, superficial, and it just walks you through it and gives you these presets that can at least get you started. And once you get more comfortable with the technology, you have a better idea if you want to modify that and make it more aggressive or less aggressive depending on your client. So it's kind of nice for some people who are newer to lasers to have those presets. And I will tell you, photofacial is the most technique dependent out there, in my opinion. There's the most variables in the treatments that you're going to, or the lesions that you're going to treat, and more variables in settings, especially if you have a good device. The other thing that I really love about this that I have not found with another device, and maybe it's out there and I just don't know, is the ability to have multiple pulses. So meaning when it's intense pulse light. So I can make my setting to be 1 pulse, 2 pulses, or 3 pulses. So just for an example, if I was using 30 joules and I had 3 pulses, that's broke up into 3 pulses of 10. Or if I had 30 joules and 2 pulses, that's 2 pulses of 15. Or if it was 1 pulse of 30. So I can adjust my pulses. I can adjust the duration of each pulse, how long the pulse is, and I can also adjust the delay, the space in between those pulses. And the reason that that's so important is if you are going to be treating darker skin types, as I do quite a bit in our practice, especially we have a lot of Hispanic clientele, you want to be able to have 3 pulses to make it a little bit safer for your patients. If you're trying to treat darker skin types with 1 pulse, then you really have to lower your energy and you're not getting a really effective treatment. So I know most people, you have to work with whatever you have, but if you're in a position to be looking for an IPL device, or if somebody's looking just to have a photofacial treatment and they're trying to understand the difference, it can be really confusing knowing what's the difference between one thing and another, and why is it that not all photofacials are the same, and why you might go somewhere and get a really good result and go to another place and not get a good result. So it's very much technique dependent, which comes with a lot of experience, and it's also dependent on the tool, to be quite honest. So I just thought I would share with you what this particular device does, and since I couldn't show you the screen, I'll take pictures and show you what the screen looks like with the prompts. And I also have a blog, Best of Both Worlds AZ, and on there I talk about the difference between lasers and IPL. So if somebody's really wanting to understand more about that, certainly you can go to Best of Both Worlds AZ. If you're wanting to know more about this particular device, it's made by Luminous. So you can go to the Luminous website and you can put in the M22 and they will have like a description of what this machine is and the different modalities, because you can customize your platform to your practice and what you need to do. Maybe you don't need the Reserve FX. Maybe you need everything on your device. So I just thought I would share that. I love working with this device, and I'm especially excited about the vascular part of this treatment.